who arrived in the country from France by Royal Air Maroc, flight number 8579, on the 15th of March 2020. He was in the same flight as the first case, even though they originally departed from different countries. His issue was reported to the Rapid Response Team through the National COVID-19 Hotline 1025, being operated by the Ministry of Health. A sample was collected from him and the positive test result came out on the night of the 28th March 2020. 16 of his close contacts have been placed under quarantine. Plans are underway to have their samples collected for COVID-19 testing. For the probable case, we have a new probable case that has been reported as the laboratory results of one of the contacts recently came out inconclusive. So that is the probable case we are talking about. A repeat sample from the probable case will be taken and tested in a couple of days to conclusively determine whether it would be COVID-19 or not. We appeal to all contacts to call the toll-free number 1025 for advice so as to protect their families and the general public. The Ministry of Health appeals to the general public to remain calm and vigilant and follow the preventive measures at all times. The Ministry also appeals to the general public to follow the executive directives issued by His Excellency the President to stay at home as and when they can, to have social distancing, to close down the unnecessary or unessential social distancing because it has been proven to be effective. The virus doesn't move by itself. It is moved by people and it moves from one person to the other. Therefore, it makes sense that when people stay away from each other, at least at recommended distances, the virus is not likely to spread. We repeat, let's please practice social distancing to protect ourselves, to protect our families and loved ones, to protect the Gambia as a whole. We also appeal to the people who have symptoms to call the toll-free number 1025. In so doing, they are able to protect their immediate family members because those are the people most at risk. Hence, the community at large. We need our collective efforts to be able to contain this disease. COVID-19 is no longer a thing of other countries. It is currently in Gambia, and we've started having cases, and we have registered another positive case. This sends a message, this sends a signal that more needs to be done. And we are all aware that that positive case was living with his family. 16 people are considered as contacts, and they have all been taken into quarantine. But we appeal again for people who have a travel history, people who have symptoms similar to that of COVID-19 should please come out and get tested and get medical attention to help themselves and their families and the nation at large. Once again, we thank you all for your kind attention.
Yes, thank you very much, Senator. So we'll take questions. If there are none, we go. All right, thank you.
Not
That was
today.
the probable case before.
Yes, we didn't talk about that today because we spoke about it yesterday and it was found to be negative. Teranga, I think you were left out yesterday. Yeah, okay. It was found to be negative. Yeah.
All right, thank you very much.
One more question.
Yes, yes. One more.
My question is actually regarding the relief funds that have been released by the government, if it is with the ministry yet or not, and what the fund is exactly meant for.
What is that, please?
The 500 million
Mhm.
that has been approved by cabinet, if it is with the Ministry of Health, yes, and if yes, what is the fund really meant for?
So the fund is not with the Ministry of Health. Government funds, the custodian is the Ministry of Finance, and they are disbursed through the Accountant General's Department, the Treasury. So those funds, the fund has been put in an account. That is, so the custodian is the Treasury Department, under the Accountant General's Department, the Treasury unit. So when the funds are actually for our preparedness and the response. The funds are for training people. The funds are for procurement of personal protective equipment. The funds are for procurement of equipment. The funds are for procurement of vehicles so that our people are able to respond in good time. The funds are for procurement of ambulances. The funds are for giving the people who are participating and sacrificing little allowances here and there, to compensate for the hard work that they are doing at the front lines. The funds are to buy materials that they need. The funds are to pay for the hotels that the people who are in quarantine staying in. The funds are to pay for the feeding of those people. So for a host of activities, and also the procurement of communication materials. You've seen posters, you've seen billboards. So the funds are for all that. You've seen sanitizers being supplied to the facilities. So the funds are for that. So usually, how the funds are disbursed, requests come from the various units. Requests come from the various units of the, we have a national emergency health committee that has six thematic areas. So requests come from each of those thematic areas. They get to the ministry, to the permanent secretary. He looks at them, discusses with them, and then we set up a committee. I inaugurated that committee a few days ago, last week, and that committee has the permanent secretary of the Ministry of Health and few other senior officials, permanent secretary, Ministry of Finance, few senior officials, the accountant general, the director general of internal audit, the director general of the Gambia Public Procurement Authority. The idea is to expedite the processes, but to make sure due diligence is followed when all those people through whom these documents need to pass, they sit at the table, look at them, because we need to respond fast. So that, because if we respond slowly, that the effect of what we want to do can be compromised. So we need to respond fast so that these things can be done, having all those people on board. The other point of having all of them on board is so that at that level, at the beginning, even before disbursement, there is transparency, there's accountability. All those people involved will make the decision, and it is a collective decision done in the best interest of the government, the best interest of the country, in an accountable, transparent way. Thank you very much.
My question is, what devices method is the ministry taking? Henceforth, we've seen that there is increase in the confirmed cases. And then the other question is,
Okay, go on.
okay, the other question is there any provision for journalists that are keeping the front line in trying to cover your press conferences, cognizant of the fact that the virus is airborne, like protective clothing?
I have got his confirmation.
Yeah. Thank you very much. We started having cases. The most recent case went to the government treatment center. The team had been on standby. The nurses, the doctors, the lab people, and the entire team had been on standby, and they received the patient and started caring for the patient. So that's what we are doing. We are increasing the treatment centers across the length and breadth of the country. We are providing for these patients what is needed, what is currently accepted as the kind of care that these people need to get. That's what we are providing for them, as it is done in most other countries in the world. Fortunately, our patients are stable. However, we're doing a lot to strengthen our ability to care for these patients. We're bringing in a lot of equipment very soon, inshallah, including ventilators, including monitors, and so many other related equipment are expected in this country soon. And we also want to use this opportunity that are potentially detrimental to the people of this country. Unfortunately, I was very saddened by the fact that people, without getting information, can go ahead to mislead the people. I think that is very, very unfortunate, and this is not time for people to be misinformed. This is time for people to be given the right information, and if we do not have the right information, I think the best thing is for us to keep quiet. Other than that, will cause more harm than good. Now, the donations we received yesterday, they were not medicines, they were not injections, they were test kits to be able to enhance our ability to test patients or suspected people as to whether they have COVID-19 or not. They were personal protective equipment. They were masks, outfit to protect our staff and other personnel who are close to the affected individuals. So we want to clarify, those were not medications, those were not injections, but test kits and personal protective equipment. Thank you.
Yeah, the other question is
Protecting journalists. He was asking about how to protect journalists because they are on the front line.
Yes, so first of all, it is important to know a little bit about what we need to do and when we need to do certain actions. So we are circulating the guidelines with regards to use of personal protective equipment. So those guidelines, the director did give your members copies the last time, so that the first thing to know is to know when you are at risk, and under various risk categories, what you need to do, when to put on the mask, when to put on the gown, when to put on the gloves, when to put on the goggles or the face shields. These are all important for you to know. There are certain times that the risk is pretty low, or there is no risk at all. Under such circumstances, probably you may not need to put on anything. But when the risk is present, even if it is low, you could put on some protective gear. When the risk is higher, you go higher. So you need to be taught this. And I have a feeling that most of you had some training with regards to that. And but for those of you who were not trained with regards to that, I think you all need to be trained. And our people will be very willing to train all of you. Few days ago, we met with the Gambia Press Union team, the GPU, and we said we are equally ready. We are ready to provide personal protective equipment to your fraternity, because you are all part of the team. So the materials are ready and they are for use by all of us, not just the healthcare providers, but they are ready for use by the journalists as well. You let us know when your stock is depleted, so that you get supplied more materials. Thank you very much.
Thank you very much, Honorable. I think that's it.
Yes. Good? Thank you. Yeah. Yeah.